So, what sensory discrimination and perception problem? So, sensory discrimination and perception allow to refine organization and interpretation of sensory stimuli. For type, for some type of sensory integrative disorder involve inaccurate organization of sensory information. For example, for example, difficult to differentiate one stimuli from another, or difficult to perceiving the spatial or temporal relationship among the stimuli. So, for the classic one, example involve visual system. For all the children that have a learning disability which persists in confused AV with A and D, however, a child with an auditory discrimination problem may be unable to distinguish between the sound of word doll and doll, with a child with tactile perception problem may not be able to distinguish between a square block and hexagon block using only touch without visual prompt. Actually, for children with perception problem have not difficult with sensory modulation. However, modulation problems often coexist with perception problem. It makes sense that these two types of problem are associated. For a child that cannot often does not register stimuli properly, have some difficulty in perception skill because of lack of experience interact with sensory information. For the child who has the sensory defensiveness, have extra 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 a lot of energy trying to avoid certain sensory experience. Because of defensive reaction may make it difficult to attend to the detailed feature of the stimulus, and therapy may independent perception. From most factor analysis studies of the SIPT test score reveal the pattern of the link sensory perception with motor function. Certain pattern reflect spe- specific factor. Oh no, is a specific sensory perception factor. For example, a visual form and space perception factor or the tactile perception factor, as well as the somatosensory perception factor. Professionals in many fields, such as neuropsychology, special education, and speech language pathology, are trained to evaluate perception problems, and their focus usually in the visual and auditory system. In contrast, occupational therapy is unique in their understanding of the functional relevance of lesser known areas of sensory perception such as tactile, kinetic, and vestibular sensory processing. Tactile discrimination and perception problem. Poor tactile perception is one of the common sensory integrative disorder. Child with this disorder have a difficult to interpret tactile stimuli in precise and efficient manner. For example, they have a difficult localizing precisely where the object was brushed against them, or using stereognosis to manipulate an object that is out of their sight. Fine motor skills are likely to suffer when the tactile perception problem is present, but it will become more worse if the tactile defensiveness is also present, because it will block out to the child to have the experience to improve their tactile, because when tactile deficiency is present, it will lack of experience, and it make the kid that have tactile defensiveness take more longer to reduce the tactile perception problem than other kids that have tactile perception problem without tactile defensiveness problem. Tactile system is critical modality for learning during infancy and early childhood. Tactile exploration using hand and mouth is particularly important. If tactile perception is inaccurate, the child is disadvantaged in the learning about the different varieties of the object and substance. It may be difficult for a child with a such problem to develop the manipulative skill needed to efficiently perform tasks such as connecting pieces of the constructional toys, fastening, buttoning, or snap, braiding hair, or playing marbles. In the kit, tactile perception also interferes with the feedback that is normally used to precise guide motor tasks, such as writing with a pencil, manipulating a spoon, or holding a piece of paper with one hand while cutting with the others. Tactile perception is associated with visual perception, thus it is fairly common to see children with problems in both of these sensory systems. Not surprisingly, the children tend to have concomitant problems with eye-hand coordination. Is discrete somatosensory perception factor emerge as a pattern in analysis of the SIP team, but more striking finding in a factor analytic studies of sensory integration tests over many decades was the link between the tactile perception and motor planning, which recurred in many different studies. These findings lead areas to hypothesize that tactile perception is an important contributor to ability to plan action. Because of the tactile, we can